So EMDR is eye movement desensitization reprocessing. So it's a long mouthful of words, but it's EMDR. So what happens with EMDR is we're working on the eye movement. So when the eyes move from right to left, our brain's actually filtering out memories we don't need. So our eyes go from right to left naturally when we're asleep, in the REM sleep cycle. So when we're in a deep sleep, our eyes are going from right to left, filtering out what we don't need. We don't need to remember what we had for lunch. We don't need to remember what we talked about at the post office yesterday. We just don't need to remember those things. But what happens when we have trauma is we remember these memories, right? And those memories are associated with uncomfortable feelings in the body, emotions, and dysregulation in the nervous system. And so what happens is when we do EMDR, what we're doing is we're doing the REM sleep cycle on that memory. So we're telling the brain, I don't need this anymore. I don't need this anymore. And so what happens when we do EMDR is it's a peak as well. So what happens is that person's intensity will increase in the body, the emotions, as we do the belief system, the memory, the sensations, and it will peak. And then what happens is it comes down on the other side, and then they start to feel nothing for that memory anymore. So it's like might go from a 9 or a 10 to a 0. And so that's what EMDR does. It's filtering out the memory that we don't need anymore.